Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, January 12th, 2021. So it looks like perhaps finally after the holiday slowdowns, data reporting is getting slightly back to normal. We may still be seeing a little bit of backlogs in the current numbers. That means they may be slightly higher than are actually happening right now, but that only means that if case counts seem to drop in the next week, they're not really dropping. Worldwide, we crossed the 90 million mark. That was about 5 million more than we saw the week before Christmas. Here in the United States, we just crossed to 22.5 million, getting about 300,000 more in the past week than we did, again, that week before Christmas in December. And here in Massachusetts, we've seen over 40,000 additional cases in the past week. In terms of deaths worldwide, we are getting very close to the 2 million mark worldwide with almost 90,000 deaths in the last week. So we may well cross that by this time next week. Looking at these numbers graphically, here in the United States, testing has almost rebounded to the point where it was before the holidays, but everything else is has jumped back on there. You can see all these trends have a brief sort of plateau after they recovered from the holiday slump and then jumped back up there. So that's probably somewhat backlog cases, but it looks like we're also now perhaps seeing just a general increase probably from the holidays. Hospitalization trend continues on there, and deaths have also spiked. If you'll notice here that while yesterday was not a single day record in any metric, Mondays usually aren't. The 7-day average, however, is a new high for everything except testing, which is the one thing we do want to be high. So looking at where this is happening right now at cases by population by the various regions. It is looks like the West is now the highest region there. California is getting something like 40,000 cases a day. And they are moving towards being higher than even the Midwest peak in the late autumn, early winter. Here in the Northeast, though, we've seen a significant jump since the holidays there. That more than makes up for the missed cases there. We had a bit of a plateau shortly before, and then now things have just really increased there. Also, the South has skyrocketed there. That is a larger region, though, so it's always going to be a bit smaller on a population scale, which means that there is a lot more cases happening there. In terms of hospitalizations, we should expect to see these jump as well in about 2 to 3 weeks as hospitalizations trail cases. At the moment, though, things are holding fairly steady, except in the South. The West and Northeast were more or less plateaued for a little while there, and the Midwest has been steadily dropping off since its spike in late November, but we should expect to see most of these change pretty soon. In terms of deaths, these are picking up around the country. Perhaps the Midwest is still trending downwards overall once we get through the backlogs there, but the individual dates are still about where they were in late December. Everywhere else, though, is steadily increasing, dramatically increasing in some places like the South and the West, as you can see there. Let's move on to developments. We passed a milestone yesterday, not a milestone, an anniversary of the first COVID death. It was 1 year ago yesterday. And it's hard to believe that it's been a full year since then, and almost 2 million more people have died in that time. Just how much the world has changed since January of 2019. Or 2020 even, in fact. Also, Massachusetts is planning to roll out a system of pool testing for K through 12 schools. Pool testing is a system where you take test samples from a large group of people and pool them together and test them in groups rather than individually. It makes for a much faster turnaround, more efficient. If any group tests positive, then you go back and test the individual samples. But if the whole group tests negative, you can be pretty safe that no one in that group pool is positive. This is a pretty helpful system for getting something like schools back online because you can do much more screening testing this way. You can test every student every week. The cost is supposed to be something around like $5 to $10 per student per test, so it is relatively cheap and may be a good system for keeping schools open as long as possible. It has already been piloted in a few districts. A new study came out recently, just last week in, I can't remember if it was Science or Nature. It was one of those two. I want to say Science, but showed that immunity is still robust after 8 months from the time of infection. That's very promising, both in terms of the protection that people who have already been infected have, and also since immune response from vaccines is generally better than natural infection. This also bodes very well for vaccinations, that anyone getting vaccinated now has at least until fall of protection, probably longer. Also, with the events in Washington, D.C. last week, we're likely to see a super spreading event spread out from that, both from people in the crowd and also in the lawmakers who were sheltering in place, many of whom were not wearing masks. There have been already 3 representatives who have tested positive in the last 2 or 3 days, who were present in the shelter-in-place areas in the Capitol. So we may see more members of Congress testing positive in the near future. So another example of this human to animal transference of the virus, 3 gorillas in the San Diego Zoo have tested positive for COVID-19. All 3 are expected to recover, but it's another example of how the virus can jump from species to species. This is the first time we've seen it in primates, but it's probably happened before other places, just not as apparent as a popular zoo. And checking the vaccines. So here's how vaccine progress goes. At this point, I'm probably going to retire this slide because we already have several vaccines in the mix. Whereas meanwhile, I think it's time to move over to a new slide, which is the vaccination progress rather than the vaccine progress, looking at how many vaccines have been given versus distributed across the United States and Massachusetts. Hopefully when I can find some good data on vaccines given around the world, I can add that too. Right now though, the United States has given about 9 million vaccinations. Here in Massachusetts, we've seen about 450,000. However, there have been 25 million or more vaccines distributed, which means actually sent out to the states. So only about 35% of those have been given across the country. Here in Massachusetts, I actually have those numbers backwards, looks like there. We've actually only given 197,000 out of the 458,000 we've received, so about 43% of them. Vaccination is still going very slow at this point. We're hoping to ramp up shortly, hopefully as well, once we get through the first phases that have very restricted populations. It'll be much easier to speed this up, as we don't have to worry about making sure that only certain people get it at certain times. Once it gets open, we can just open mass vaccination drives. And you can find our data from the usual places: mass.gov, New York Times, COVID Tracking Project. And one final thought before we go. You may have heard about the variant from the UK, B.1.1.7, which is circulating around the world, has been confirmed in a couple places in the United States, which means it's probably in a lot of places. And it is likely to be somewhere in the range of 40 to 60% more transmissible than the vanilla COVID. And for anyone who's asking why is a more transmissible virus more dangerous than something that's more lethal, here's a quick chart that explains the difference there. Well, a strain that is more lethal is likely to kill more people in the short term there. A more transmissible virus will hit more people and thus get to more vulnerable people in exponential growth there. So the red line would be a variant of the virus that is 50% more lethal, while the yellow one is one that's 50% more transmissible. And here shows the final deaths. This is why it's very important this time, especially while we have vaccination campaigns ongoing, practice all those public health measures we've been talking about since the beginning of pandemic, which include washing your hands, wearing a mask, and keeping your distance. Also, if you are looking for more from the Mass Support Network, you can find us on our website or on social media. And remember, keep wearing that mask, keep washing those hands, and we'll be there if you need us. Stay safe.